Hello, everybody. We're here with a special guest, Dr. Norma Cortez, and she is a biological dentist, and she's going to tell us a little bit about her story and how she started introducing airway issues with her patients. And is also going to give us a lot of information about, for example, tongue ties. This is something a lot of people don't know about and is very important, especially for moms that are having kids that are having issues maybe breastfeeding or they're having issues swallowing. So she's going to give us a lot of information about that. Thank you so much, Dr. Cortez.
Thank you for having me. I'm very excited.
Thank you. And tell us a little bit about how you started. Why did you transition into a conventional dentistry first and then into biological and now specializing in airway and tongue tie?
So it all started when my child couldn't breastfeed, my second child. And it was really painful, and I just knew it was not normal. At the same time, my first child was 2, and he started snoring. So my introduction to integrative medicine or dentistry started with airway. And so that's when it opened up my eyes and I started looking into other areas, not just dentistry. So I started working with a chiropractor, speech language pathologist, and IBCLC. And I realized that they are taught many things that are opposite to what we're taught in dental school. So that was interesting. And so the more I learned, the more I realized, oh man, that is just different, right? I'm also from Peru, and what's known and accepted in my country, it's a more holistic way of living or of practicing medicine. You go to the kitchen for remedies. You don't go and have a pill, right? So that was how I started.
Can you please explain a little bit about what is that connection with tongue tie, for example, and the painful breastfeeding, and what is it that you do in cases like that? What are your recommendations for moms when they're dealing with this problem?
One thing that I want moms to know is that breastfeeding should not hurt. That's number one. So it all starts in utero at 20 weeks when the tongue is attached to the floor of the mouth, and by a fancy word, apoptosis, it opens up. And that allows the tongue to start moving. The baby is born, and there is some nerves that connect and send signals to the tongue for it to move. There is the suck, swallow, breathe synchrony that happens and rules the baby's word. It allows them to suck, swallow, and breathe. So the tongue for breastfeeding needs to go forward to the lower jaw and then do a movement, a pumping movement, and it's from a high grade to a low grade that the breast goes. No sucking, no pain, supernatural. So if any of the 4 components are different, such as the signal not going to the cells for any cranial strains, the cells not understanding what's going on, or a physical attachment, then the baby will have a shallow latch. The mom can have some pain. So ideally, when you're dealing with a tongue tie on a baby, you have to check for the latching, which is an IBCLC area, the oral motor sensory that an SLP or speech language pathologist checked, cranial strains, usually by a body worker, chiropractor, and then a dentist or physician who can actually do the surgery to relieve that anatomical restriction. The babies are so integrated that they will know how to start sucking and swallowing and breathing. Sometimes you need some coaching, but the earlier is the better.
So then what age would you be able to address that? How young can the baby be?
I would probably say a week or 2 weeks. We still want the baby to learn the mom. And when we talk about a mom and a baby, we're talking about a diet. That's something that is super important. the mom, if we do something to the mom, it's going to affect the baby. And if we do something with the baby, it's going to affect the mom. So we're talking about one person, the diet, the mom baby connection, right? And so that we want them to get to know themselves for 1 week or so. And then after 1 or 2 weeks, then that's when you really know you're doing everything possible and it's not happening, that's when a surgery might be indicated.
So some of the signs for mothers to know if the baby has a tongue tie would be, for example, like if they're trying to stick their tongue out and then it creates like a little V shape,
Mm-hmm.
um, or maybe you lift the baby's tongue and it looks like there is a tissue that is really thick connected in there. What other signs can they look at and see if this is a possibility?
That is great. That is the physical and how it looks. Another
Mm-hmm.
thing would be on the mom side, lipstick shaped nipple after breastfeeding, pain,
Oh.
even bleeding. Bleeding is not normal. Mommies don't suck it up. On the babies, a gassy baby, because if you think about it, the baby unlatches and it swallows air, and that can cause issues. So, colicky babies, babies who are crying, a big tummy full of air, um, that's another sign and symptom of something is going on in that
Mm,
baby's mouth.
very good. And it is really important for mothers to understand. And I love that you're saying that don't suck it up. Don't, if it's painful, this is not the way it should be. So then just start addressing, and you can address it as early as 1 month. Is there something that the mothers can do prior to this? Can they do, like, is there a massage? Is there something that they can do to start like a myofunctional therapy that they can start doing?
So, mom's myofunctional therapy is usually for kids 4 years and higher, right?
Mm-hmm.
Before it's more feeding therapy. But I
Mm-hmm.
highly recommend when moms bring themselves and all their babies for a massage. That is super, super important. It calms the baby down. And the best person to do that is a chiropractor, right? Also, because there are milestones that they can go ahead and check.
Mm-hmm.
Um, yes.
It's really important. This is very, very interesting that mothers need to know. So there is myofunctional therapy, and this is a therapy that a specialist does to help the kids start learning how to position the tongue, because the tongue needs to be in a specific position to be able to swallow, to be able to speak, and to be able to help the bones expand and align. But this can
Mhm.
start only at 4 years of age. But then what Dr. Cortez was talking about is a massage that the kids, the babies can have. Can you explain a little bit more about that, please?
So if you see, there is, I think there was a couple of years ago, a dissection of the fascia, and the fascia is what surrounds the organs, the muscles. And one of those dissections is shows the connection between the tongue to the tip of the toes, right?
Isn't it
So
incredible?
it
That
is.
lung connection, that's one more kind of doing an emphasis of how the mouth is connected to the rest of the body.
We have one body. We don't have pieces running around together.
Exactly.
but um,
Yeah.
and so when that fascia is constricted, usually there's crystallized hyaluronic acid, right? And there's
Mhm.
many ways to address that, right? You can go fancy and go to a laser therapy. You can just go and just go to the regular good old massage to relax everything, right? That is
Mhm.
called body working. And a craniosacral therapist, chiropractors can do it. Myofunctional therapy is more of a training. So think of I am going to coach myself to be fit and to know what they need to do, right? And in children who are not as cooperative, you do more of an infant feeding or feeding therapy for that. And that also starts with babies. There
Mhm.
are SLPs usually, or OTs can do that. and they can specialize on training and strengthening the muscles of the mouth, including the tongue. And that makes a huge difference. I've noticed that when I do a couple of exercises and the baby works for that latch, the baby goes to the breast and it's better. The moms feel just a difference, just with a simple, not simple, but efficient training.
Hmm. That is incredible. And the babies, when, for example, because the procedure to help with this tongue tie is to have a little surgery. For babies, the healing is just incredible. It's a lot faster. And then,
Hmm.
as you say, they start sucking really well, pretty instinctively.
Hmm. Yes. So the younger the baby or the person, the less cells we have to cut, if you have to think about it, right? And babies are very instinctively. They usually go back up, and because there's no many compensations. The older
Hmm.
we get, the more compensations we create, the more coaching we need. So, for example, in an adult, we have compensated so long, we definitely need to be myofunctionally ready before any type of frenectomy or frenuloplasty.
Yes, and a lot of people don't do that, and they struggle learning how to position the tongue, learning what to do, what's happening with the muscle. So it is a good idea to do that. And I've seen oral surgeons that they do it without any myofunctional therapy prior, and it's a disaster.
I
It's,
agree.
mhm. Yes,
So
yes.
think of your tongue to going to the gym. From a surgical perspective, everything the anatomy shows up beautifully to where you know exactly where what you need to cut. The anatomy, the veins, when there's veins there, the arteries, all goes behind, and it just goes sooner. The tongue is fit. The tongue knows where to go after,
Hmm.
because you're
Hmm.
gonna have a better range of motion, right?
Yes.
So even for orthodontics, I am a big proponent of myofunctional therapy to make your muscles or bones in harmony after you move teeth. But somehow that is not the case,
That
usually.
is not the case. And this is very good because it ties with the next topic I would like to touch on, and it is the sleep and airway issues, right? Because if we are having a narrow arch, if the patients have a very narrow arch, especially kids and adults as well. But if we start young, then we can start changing this. So we will prevent some sleep issues in the future or airway issues in the future. So when we start early, it's a good idea. We can always treat adults as well. But then just can you talk a little bit about, so if we don't have that position, that correct positioning of the tongue, we're going to start having some consequences, and one of those are airway issues, and then also, yes, expanding and creating the ideal shape of the arch for the patient to be able to position the tongue in the right way.
That's correct. So the tongue should live at the roof of the mouth. The roof of the mouth, the bone is called maxilla, which is also the floor of the nose. So do you see the connection between breathing and teeth, right? When the tongue goes up, it expands naturally and it also moves the craniofacial growth forward. And if you think about it, the mouth is forward or anteriorly to the airway. So if you grow the right way, you open up your airway. So there is one truth that dentists do not diagnose sleep apnea or sleep disorder breathing, but we influence the airway with orthodontic intervention or myofunctional therapy. So by doing that, we surely increase and make our airways bigger, which makes a huge deal. It decreases the chances of a patient to have sleep apnea or even TMJ, temporomandibular joint dysfunction, or even pain.
Correct. If it's just what I tell my patients is just imagine that you have a garage and the garage is small. This is if you have a
Mhm.
narrow um, arch. Then you're gonna try to park. a big car, a truck in this small garage. That's your tongue trying to sit in the garage or in the arch. What happens is that if there is not enough room, where does the tongue go? It goes back. And when it goes back, what happens? Then it reduces the airway and it causes other issues.
Yes,
So
totally.
we
The
don't
num
diagnose the sleep apnea, but we can see the signs that there is something that can be potentially happening in this patient if we don't address it on time.
yes, and in the literature says that the number one and two sites of obstructions are the soft tissue and the tongue.
Mhm.
So there is evidence, there's clearly evidence about that. So we can definitely help. And that's another thing that I tell my patients is the sutures do not feel fully fused, they interwoven more. The chiropractors know that. So, is it possible to expand an adult? Yes. It's a little challenging with the same appliances that you can use on a child, but it's possible. There's many ways to do it. So, taking teeth out in the name of or in the name of not being able to expand, it's a little erroneous. So if you've been said that or told that you need to have your teeth out, maybe seek a second opinion. You deserve that, and then make your decision. Right?
Correct. Yes, that's true. We have all the teeth that we need to have an ideal bite, an ideal space for our tongue. So it is not necessary to remove. And I've seen a lot, and probably you have seen, when the patients have the premolars, which are the teeth that are usually removed for orthodontia, as adults, the spaces open up, but the arch is not developed correctly. And they end up having sleep apnea problems, which for people to understand that sleep apnea is that when we're going to sleep and then we wake up multiple times because we stop breathing, so there is not enough oxygen getting in our system, in our body, to be able to function correctly and just to be able to reset the nervous system, the immune system, and the respiratory system. So then we start having a lot of complications with that. I know that
Mhm.
you created a an institution. Is that what you created? Something for the tongue tie? Is that correct?
So I do have a multidisciplinary tongue-tied center,
Mm.
mainly for babies, where chiropractor, Dr. Sambungi, my IBCLC, Natalie Words, and the speech language pathologist, Brittany Kirschner, we all joined in this crazy adventure to help moms. So, as a mom, you know, I have two children, so we're sleep deprived. The easier, the better. So they come and they get assessed. They have four of us assessing in our different domains and then present, and they make the decision if they want to proceed or not with the surgery. Sometimes we tell them your baby has low tone, we need to strengthen that, and then you need to go to see a chiropractor first or a speech language pathologist first, um, before I release. So that's better. I believe in a multidisciplinary approach to health.
I agree. I agree. As we mentioned before, it's one single body, one body, and we need to address it in different angles to be able to achieve health and well-being. Do
Yeah.
you have a story that you want to tell us of a successful story from a patient that you treated and then you saw these amazing results?
Yes. Oh gosh, I have so many stories. There is two one specifically. One just happened recently, so it's fresh in my mind. When moms come, it's overwhelming. No one wants to have to do that to their children, right? Is it the right choice? What's going on? I can clearly see that. Can I suck it up instead of you cutting my baby or addressing what needs to be addressed? But when they understand that, I call that informed consent, when they understand that they get empowered to make their own decisions, there's this baby that the next day, she was another baby. It was a relaxed baby. She was so fine. And the mom said, yeah, 2 days later, it's like, I have another baby. She's not crying as much. and you can see her face is more relaxed. That was the recent
Oh,
one. And then another mom, she weighed the previous baby. We addressed it and did surgery maybe 2 weeks after, so she was 2 weeks old. The first one that I remember, and I still remember, is she waited 6 months. She did not know anything. She went to the pediatrician. The pediatrician said the usual: formula is fine, your baby's fine, no problem. But the baby did not stop crying. It was 6 months of continuously crying, which is not healthy for no one of us,
mhm.
right? Nor the mom nor the baby.
Correct.
So when
Yes.
they came to us, of course, she was hesitant, right? A pediatrician has said that the surgery is not needed. So we did the surgery, a transformed baby. They were finally be able to sleep through the night. The baby was more relaxed, less colicky. It She came crying on the second. It was very emotional. We cry a
Oh.
lot in our clinic for the good reasons, but yeah, yeah, it's nice.
Those are great stories, and I'm sure that you have a lot more like that. And it is a simple procedure and it's fast, but the results are incredible. And not only for that moment or for a few months, it's just for life. Because this baby is not gonna grow having issues with the tongue tie and having problems with their tongue position and maybe having a collapsed maxilla because there is no muscle pushing and guiding that growth. So this is going to be an adult that is going to have issues. And we have seen a lot of kids, for example, that they struggle in school, and then we can have this combination of the tongue tie, but then there is also some sleep disorders. So let's talk a little bit about that and the sleep disorders and airway issues with kids that are, for example, in school. And I've seen a lot of them that they are diagnosed with ADHD, and what they're having is just that they're not sleeping correctly or they're not able to have a restful sleep.
Yes, I totally agree. And unfortunately, they're prescribed a a pill just
Yes.
to get them through the day. So what happens in children? In adults, first, when you're tired, you're exhausted. When a child is tired, they act up. They have
Mhm.
behavioral issues. If you're a mom, you know that child needs a nap when they are bouncing off the walls. So when you do an airway assessment, or when I do an airway assessment, I check for tonsils, if the baby or child is mouth breathing, for ankylosing or a tongue tie, for a narrow arch or crowdiness, or even in children, a lack of primary spacing on baby teeth.
Mhm.
All of that indicates a simple fact that the face is not growing, right? And what grows the face? Tongue up to the palate or the roof of the mouth to grow that. So we create an airway. If any of those components is missing out, then the baby is not, or the child is not growing. Especially also if the child starts to mouth breathe, you cannot nose breathe, and your tonsils can get a little bit bigger. So the
Mhm.
number one line of defense is tonsillectomies if
I
it's
know.
bad, because the brain needs as much airway as possible. There is literature about that, so it's nothing new. Yes, those tonsils are going to shrink around age 7, but the biggest time, or the time where the brain grows the fastest, is from 0 to 5. So that's when they need more oxygen. So I'm not from the school of thought of waiting for the lymph nodes or the tonsils to shrink, because we miss so much on that airway intake for the brain.
Mhm.
So that's the first line of defense. But also, if you can start also growing the child's face, it's not only going to be good for your bite and your future bite, but it's going to grow that airway so the baby can nose breathe, or the child can nose breathe, and have a less chance of having issues in the future, such as sleep
Mhm.
apnea or pain in the jaw.
Correct. Yes. So then what are your recommendations when you see that there is a patient that is having some sleep issues, some airway issues? What are the steps that you recommend parents to do?
If a
First, maybe have a sleep study.
Yes. Yes. So I would highly suggest a visit to the following: an airway focused dentist, an airway dentist, an ENT, an airway minded ENT, a pediatrician, someone who can prescribe a sleep study to see if. Now, in children, it's a little challenging to do a PSG or a sleep study. So there is another pediatric sleep questionnaire. It's a study done by Chervin, probably 10 years ago, that it's equivalent to a study. So if you can do a PSG, a pediatric sleep questionnaire, um, that can give you the signs and symptoms to see if that child has sleep apnea. But seek help for sure. That would be my
Hmm.
first.
Hmm.
Don't wait, don't brush it off. Don't feel that you're the pediatrician or even the dentist is saying, oh, they're gonna grow out of it. No one grows out of it. If you're not growing, you're not gonna grow out of it.
Yes, you need guidance, you need some help, and maybe so then the next step will be, depending on the severity of the sleep apnea, just address the main cause. So expand if it needs to be expanded. So do you use a specific appliances for them for the expansion? What are, especially when we're talking about younger kids, or like toddlers and preschoolers?
So the first thing is cooperation. So the best treatment is the treatment that the patient is going to do, right?
Yes,
So
that's
with
correct.
younger children, cooperation is sometimes an issue. I suggest preform appliance, and there's so many. I can bring names: Healthy Start, MyoBrace, Tooth Pillow, Vivos. They have preform
Hmm.
appliances for the baby. Uh, Wears it a couple of hours during the day and then at night, and that creates two things. It not only allows for the proper tongue posture, it kind of helps the craniofacial growth, and it routes the breathing from a mouth breathing situation to a nose breathing situation. And because the baby or child has not compensated that long, the correction goes sooner. But once again, the baby has to, or the child has to wear it. So
Hmm.
compliance, it's an issue. If it's really bad, and we're talking about a confirmed diagnosis of sleep apnea, a simple rapid palatal expander on a younger child is also possible. That is also Invisalign first. So once again, I go to the treatment that the patient is going to use is the best treatment. If I have a mother who absolutely does not want wires or metals in their mouth, there's options. We have Invisalign, you have those preformed appliances. If you have the mom who needs results fast and his life is busy and will not be able to help with the cooperation, you need something passive. They're okay with metal for a short period of time, because we know metals in the mouth are not the best to get that momentum going, right? So
Yes,
it all depends on the diagnosis and what the family needs. But yes, there is options, many options.
many options. And so now let's just move into adults, because there's also options for adults. So then when you see an adult that is probably telling you, I'm snoring, my quality of sleep is not that great, I wake up multiple times at night. So then the steps will be very similar until we get to the appliances, right?
Hmm. So the
Because
first thing is a proper diagnosis, and you can actually do a home sleep test with them. Depends on your state. Some states allow dentists to do that. In North Carolina, they allow me to deliver the test and then refer for the proper diagnosis, which I want, because I want it's a multidisciplinary approach. So I need a sleep physician to diagnose and to see the patient.
Mhm.
and they determine what's needed when it comes to maintenance. Usually it's a CPAP or a mandibular advancement. Now, then I do into my lane, which is okay, occlusion. I need to expand your arches. I never promise that I'm going to cure sleep apnea, but I surely will influence it. And so the sleep physician handles the actual diagnosis of sleep apnea. I handle malocclusion and the beautiness of what I'm going to create with your airway after that.
Mhm.
And you can expand, you can do many ways. And it's the same what the patient is going to do. Maybe the preform appliances, it's not going to do much for someone who's grown more and compensated so long. But an appliance that goes in and out, you can expand with Invisalign, you can do implants to open up those sutures. There's so many ways to do it. You also can address a tongue tie.
Mhm.
And if the patient is tongue tied, then a referral to a myofunctional therapist prior to the
Correct. And do
surgery.
you have you also tried doing laser, like night lace?
Yes. So I do night lace for soft tissue elongation. So the number one and two sites of obstruction in a sleep apnea, our literature says, is the tongue and the soft tissue, right? And so if I can change the collagen and make that soft tissue tighter, it surely helps. Once
Mhm.
again, I am not a physician, so I cannot diagnose nor treat, but I can treat what's within my scope, which is I see your soft tissue, it's large. Let me help you. The side effect, you're going to breathe better.
Correct. And one of the things that people can see so they can start kind of doing a little analysis on themselves is like when they open the mouth, if they don't see the opening in the back of the throat, that means maybe your that soft tissue that Dr. Cortez is talking about is a little bit lower. So then with something that is stimulates the collagen, it will firm that tissue so it will open up more. And then
Mhm.
also something that people need to be aware is like, where is your tongue at rest? Where are you positioning your tongue? And that's something that a lot of people don't know where the tongue needs to be. And then also the importance of nose breathing.
Yes, the tongue should be at the roof of the mouth. And if you think about that, if any one of your listeners want to do this exercise, you put your tongue at the roof of your mouth and open and try to breathe through your mouth. You physically can't. That routes your breathing to your nose.
Hmm.
And just by putting your tongue up to the roof of your mouth, you can become or change from a mouth breather to a nose breather, which is what we humans should do.
Correct. Yes. A lot of people start saying, oh, but I'm congested. And sometimes that can be temporary, but when there are patients that are telling me I've been congested for half of my life, well, there is something happening in there. Maybe your palate is not quite developed, or and then we look and see if it's narrow. So you see a lot of patients that have a really high palate. So then for them, it's very hard to keep the tongue up in the roof of the mouth because the palate is very high. But then what would you do on those cases?
So, first, if they have gone through myofunctional therapy and they can control and dissociate their tongue, and they cannot go up, let's say they're tongue tied, if I address that, they're still not going to be able to go up. We have to address like a rash, like you're talking about. We
Hmm.
have to expand first, then do that surgery so you can actually put your tongue where it should be, park it where it should be, right?
Exactly.
So I would say expansion first.
Hmm. Very good. Is there any last recommendations that you would like to give to mothers and what to do, and actually to adults, and see what will be the best thing to do to prevent some sleep issues and babies and down the road, or airway issues, and then to adults? What are your recommendations for that?
So my first recommendation to moms is you know your child more than anybody else. If you know that there is something wrong, there you can hear them breathe, you can hear them snore or sometimes gasp for air at night. seek help. If they say no and your mama's heart says something is wrong, continue with that. Don't let anybody gaslight you. With children, it's the same thing. So, babies and children. Adults, you're the only advocate. No one knows you better than anybody else. So, if you're exhausted, if you're tired of being tired, then seek help. And if someone says no, then seek a second opinion. It's okay. I'm not going to get hurt if you don't believe my opinion and you seek another one. It's your right.
Correct. And there is a device or an application on the phone. I don't know if you've heard of it, that we can recommend patients to so they can test themselves. And it's called what is it? A Sleep Right app?
Is
No,
it snore
a
map?
Snore Lab app. Yes, a
Yeah.
Snore Lab app. And then it can tell you, okay, you're snoring. One of the things is snoring can be a sign of sleep apnea.
Yes. So if you think about the continuum of sleep disorder breathing, right? It starts with frequent snoring, it goes to upper airway resistance syndrome, and then continues to mild, moderate, and severe sleep apnea. It's a continuum, right? It just happens that we're going to get political here. Insurance only covers the bad. But it's the same as cardiovascular disease, it's a continuum. You have high blood pressure, problems, heart attack, stroke, right? So don't wait until you're in the stroke phase or heart attack phase of that sleep disorder breathing. You can definitely have it sooner. And don't not because the insurance doesn't cover, you can still do it. You don't have to wait for the insurance to pay for that. If you're willing to help yourself, don't wait. Just do
Mhm.
it sooner, which is gonna be better.
That is a great advice. And down the road, if yes, as you say, if the insurance doesn't cover it, if you do it now, it will save you a lot of money in the future because of the consequences are going to be even more expensive.
Yes, sleep apnea is related to so many comorbidities: cardiovascular disease, diabetes, anxiety, depression, Alzheimer's, you name it. And
Yes.
so it could literally increase your chances of having a heart attack. Well, that's more expensive. We're talking about a hospital bill, not right there.
Hospital
So,
bill, not being able to work, having to stay at home, not being able to spend time with their family or quality time, your quality of life. So there's a lot of consequences that we can prevent when we start treating things like this very early.
mhm, I agree.
Well, thank you so much. Thank you for being with us. Thank you for sharing all your knowledge.
Thanks.